Well, hi, everybody. Welcome back to class. This is Module 4, Autism Spectrum Disorder. And I hope that you're doing well. And I want to just share a little bit of information with you in this little mini lecture video related to this very important and interesting topic that, like many things in this class, we really could have an entire 16-week course just over autism spectrum disorder. There's so much interesting information about this type of struggle and issue. And it's something that my hunch is you probably already know a little bit about. If I were to ask you today, share with me something that you already know about autism or autism spectrum disorder. My hunch is that all of us could probably share some things. Most of them would probably be right on target in many, many ways, because autism spectrum disorder is one of those struggles or issues related to both children and adolescents and adults that is kind of in the forefront of our knowledge these days for all kinds of reasons. Anytime I talk about autism in the classroom these days, in this current day, usually someone will say, Professor Killian, have you ever seen The Good Doctor, the show on ABC, the TV show that you can watch live or streaming? And I have seen a few episodes of The Good Doctor. If you've never seen The Good Doctor, go check it out. And it's a fictional story about a young physician in a hospital setting who has autism or autism spectrum disorder. And so that's just one example. That's just one reason why this thing called autism spectrum disorder is kind of at the forefront today. Is we see all kinds of TV shows and movies in this recent generation that kind of have put a focus on this type of particular developmental disability that is commonly diagnosed today. So, this is the third of four different developmental disabilities that we are talking about to kind of get our semester started. So, just as a way of reminder, a developmental disability is a disorder or a set of disorders or disabilities where the symptoms have to be first present in childhood or adolescence. That's not true for other types of disorders like mental health conditions and some of the medical, genetic, physical kinds of disorders. Not all of them show themselves initially before the age of 18. But there are certain disorders like intellectual disabilities, what used to be called mental retardation, our conversation from last week, learning disabilities, our conversation this week, autism spectrum disorder, and then next week is going to be the fourth, ADHD. Those are the four big developmental disabilities that if you take a class like this, you cannot have a class like this and not talk about intellectual disabilities, learning disabilities, autism spectrum disorder, and ADHD. And that's kind of where the authors of our textbook start. And that's kind of the order that we're taking them in this class as well, too. Autism spectrum disorder, sort of like the learning disabilities, in some ways is a fairly new type of disorder as far as in our knowledge and understanding. It has been around forever. As long as people have been around, there has been this thing called autism spectrum disorder. But our understanding of it has just exploded in the last generation or two. And we have become more fully aware of what this interesting, unique type of deficit and disorder is in children and in adults. So, again, kind of the idea with all these developmental disabilities, they are initially seen in childhood, but oftentimes the symptoms go well into adulthood. That would definitely be true with autism spectrum disorder as well too. And one of the things that's interesting about autism spectrum disorder is, again, our understanding of it and what we know about it is growing and growing and growing and growing. It's also interesting because we are seeing more and more kids, we are seeing a growing trend of the number of kids who are exhibiting the symptoms of this disorder, which is kind of interesting. There's been some debate out there around, well, why is that happening? Unfortunately, for many, many years, kids with autism were identified in most cases as having mental retardation or what we call an intellectual disability. And just in the last 25 to 30 years or so, 40 years maybe, have we begun to realize that there is a huge difference in many cases between an intellectual disability and autism spectrum disorder. And they're both developmental disabilities, but they're very, very, very different. We're going to talk here just a second about what exactly are the key features of this type of struggle. Um, the term autism spectrum disorder is fairly new, and you're going to look in your lecture notes this week, and you're going to see that for years we've just used the word autism. And just in the last few years, like the last 10 years, 10 to 15 years or so, we have kind of gotten away from that, and we really now have this new term called ASD, autism spectrum disorder. Is really kind of the technical term that we use today. Just like mental retardation now is called intellectual and developmental and intellectual disability. Um, Autism now is called autism spectrum disorder, and there's a main reason for that that I highlight for you in notes, and the notes, and it's this. Back in the day, we believed that autism was a pretty small disorder that only showed itself just a certain number of ways. And now we've come to realize that this is a type of disability and struggle disorder that is very variable. If I can use that language. How it shows itself is really different from person to person or it can be. There can be milder symptoms to more moderate symptoms to more severe symptoms. Usually, with all of these symptoms, they tend to show themselves in the first 3 to 4 to 6 years of a child's life. But how they progress beyond that varies from child to child to child. Some don't progress very far, and so someone has more milder symptoms. Others progress very, very quickly, more severe kinds of symptoms. And so the word spectrum, autism spectrum disorder, the word spectrum is really, really important because it kind of highlights for us, denotes for us, kind of our belief today that this thing called autism isn't really small. It's very, very broad and very, very wide. So how it looks in children and adults' lives, we'll say children and teens' lives because of the focus of this class, really does and can vary from person to person to person. There's a wide range of symptoms, and there's a wide range of variability as far as how it can look, from severity to what types of symptoms an individual may have, levels of functioning, levels of communication. All of that kind of thing is really, 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 really important. Before we look at kind of the three core signs we look for with this type of disorder, I want to highlight this. We are still trying to figure out what causes autism. Now, we do believe it is a brain-based type of neurological, kind of like almost like a chemical imbalance, brain development, kind of disorder. We don't think it's caused by bad parenting or birth trauma necessarily, anything like that. We do believe it is biochemical, brain-based in nature. But that's about as far as we are right now. There is so much research being done right now. My hope is in the next few years we'll have a better handle on what exactly causes autism. We're still trying to figure that out. And so even though we've learned more and more and more about autism spectrum disorder, one of the things that we're still kind of trying to figure out is what it really is, what's going on neurologically in someone when they begin to develop and exhibit these symptoms early on in childhood. So there's lots of questions still about what causes autism spectrum disorder. Now, there's a number of different ways. I may have mentioned this in our conversation a couple of modules back with intellectual disabilities. There are a couple of different ways to approach autism as far as, well, what does it look like? What are the symptoms? What are the signs? If I was concerned my daughter had autism spectrum disorder, like what would be some of the things I would be looking for? So through the years, there's been 2 or 3, different types of symptom checklists sort of developed. I want to give to you, and I've given to you in the lecture notes this week, just a very traditional approach, the 3 general types of deficits and delays and struggles that we see in kids' lives. Normally, we first begin to see these symptoms prior to the age of 6, sometimes in milder ways, sometimes in very severe ways. Sometimes autism is easy to see. Some kids who have severe symptoms are easy to identify, others less so. So there are these 3 general areas of like symptoms or signs. What's tricky is that with autism, part of what makes it kind of interesting and complicated is there's often an overlapping of these 3. And in some kids, they may have more behavioral issues as opposed to social issues. But then another child with autism spectrum disorder may have more social delays and deficits and not as much behavioral. And so that's what I mean when I say variability, right? And so among these 3 symptoms, if we were in the classroom right now, I would draw on the board 3 big circles, overlapping circles, because there are these 3 general types of symptoms that we see, but there's lots of overlap between them. The first 2 have to do with what we call deficits or delays, significant or profound deficits or delays in 2 very important areas to all of us as people. But especially in childhood, we begin to see, number 1, social interaction. So in childhood, most of us, if I were to ask you today, imagine you had a son or a daughter who was 6 or 7 or 8 years old. From a social perspective, what would you expect at that age? An 8-year-old. Some of you are parents or grandparents, or maybe you got kids that age in your house right now. From a social just means interacting with other people. What would you expect? Well, we'd say, we would expect them to have an interest in communicating with other people and socializing with other people. We would not expect them to be terrified of other people. We would not expect them to ignore other people. We would not expect them to like be kind of confused about how social interaction kind of works at that age. By the time kids kind of get to kindergarten, they've begun to learn a little bit about the idea of sharing with one another, and usually there's an interest. That's one of the big things we see with most kids of normal development. Kids have an interest in other kids normally. Well, kids with autism spectrum disorder, one of the areas where we see problems or deficits is this idea that there are delays or deficits in the issue of socialization or social interaction. So, kind of the idea is there's a mark here we expect kids to get to, and they haven't gotten there yet. So, the idea of significant deficits or delays, here's where we would expect a 6-year-old to be. If we're talking about a 6-year-old or an 11-year-old, here's where we would expect them to be, and they haven't reached that yet. So this idea of social interaction, I put in the lecture notes for you several examples. Can look a bunch of different ways. The big one for me with kids, so kids who have autism spectrum disorder often have a reduced interest in other people. They're often off in their own world. They're off. Actually, the word autism means me. It means I. And so in the early days, where the term autism comes from, was there were kids that would be like in facilities or day schools or whatever, and they would just be standing off in their own world. And people would speak to them and they would not respond. People would call their name and they would not respond. People would speak to them and they would not look them in the eye, right? And so the key thing with autism spectrum disorders is usually there is some deficit when it comes to social interaction and socialization. There can be a range here, right? From more moderate to more severe, from more mild to more severe. So it could, for example, just be a lack of interest in others. In small children, a lack of interest in sharing with one another in play. Usually kids with autism spectrum disorder symptoms want to be by themselves and they want to play by themselves. Well, most kids, especially at a younger age, they want to play with others. They want to share. They want to share their play and share and kind of play back and forth. Well, kids who have autism spectrum disorder often have delays and deficits in just sharing play with other people. Again, often kind of isolating themselves, being off in their own world could be another example of how that would talk about. Oftentimes lacking appropriate interaction. So again, that is dictated by the age of the child. So whatever age the child is, they may not understand or engage in appropriate social interaction. They may not engage in communication or reach out to other kids. What we call reciprocal play. Reciprocal play is where it's kind of back and forth, right? And so they may not understand or may not have a desire to engage with other kids or other people. And then also too, just a real basic one that we oftentimes see with autism spectrum disorder is kids with ASD oftentimes lack an understanding, a cognitive understanding, what we call social cues, CUES, social cues. So a social cue, for example, would be if I was talking to you, and as I'm talking to you, you begin to have a real pained look on your face, like you don't like what I'm saying. Most of us would catch that. Or if I'm talking to you and I'm talking to you and I notice that you just look away and you're not even paying attention to what I'm saying. Most of us would catch that. We would catch that, okay, something's not right here. A lot of times kids with autism spectrum disorder and adults, they miss those cues. They miss those social interaction cues. If I were to walk up down the hallway here at the college and I noticed two students talking to one another, and I had something I wanted to say to one of those students, most of us would wait until the conversation stopped, or we would walk up and politely wait. And then when the conversation broke, we would say, hey, I got to ask you a quick question or whatever, right? Well, kids with autism spectrum disorder oftentimes don't understand those what we call social cues. This idea that, and they're out there, a lot of them are unspoken, but most of us pick those up as we kind of go through just early childhood. You'd be amazed how many of those we pick up before the age of like 10, 11, and 12. No one teaches them to us. We just kind of pick them up. So that would be another example of a deficit or delay in just social interaction or socialization. The second core, that's the first one. The second core symptom is in the area of communication. Now, again, social and communication go together. To me, they're very, very, very similar, a little bit different. So not just a deficits, not just profound deficits and delays in social interaction or socialization. Kids with autism spectrum disorder also too struggle on all kinds of levels often with communication. Now, that can be verbal communication. So, in severe cases, kids may have no verbal language at all. They may be mute, we would say, oftentimes in severe cases of autism spectrum disorder. Or they may have delayed communication. They're not speaking by the age of 5 or 6. And they eventually do develop they eventually do develop language, but it's real delayed. And so they're way behind on where they should be age-wise as far as their language development. It could also look like that potentially. Um, Oftentimes, here's a good example of kind of how social and communication kind of overlap to me. A lot of times with the autism spectrum disorder, we see deficits where kids will not initiate conversation with others, and then they have a hard time sustaining it. So again, even at young ages, even the shyest of children, you get them comfortable, and they often will initiate a conversation, and then they'll all be able to maintain or sustain a conversation. Well, lots of kids with autism spectrum disorder kind of symptoms, they don't do that. They don't initiate, and they struggle with sustaining or maintaining conversations. There's not a lot of back and forth. You ask them a question, they give you a one-word response, and that's it. You like ask a bunch of, it's like dragging information out of somebody, right? So we see sometimes some of those kinds of deficits. Oftentimes, occasionally there may be some unusual kind of communication, like um, repeating words or sounds. They may babble at times, depending on the age, but they may have almost like an OCD kind of a thing where they may repeat certain phrases and words over and over again, or ask you a question twice. And so I've had kids I've worked with before who had autism who, when they would ask you a question, they would ask it twice, like a repeating kind of a thing. It's a part of their autism spectrum disorder. Oftentimes with communication, kids with autism spectrum disorder, it's another one of those social kind of things, but their communication is real rigid, we would say. So in other words, it's real literal. So if you and I were to say, for example, they don't pick up on figures of speech or idioms. So if I were to say to a child with autism spectrum disorder, man, I am dog tired today, they'd say, what dog? You say, oh, I'm just saying dog. And they may say, well, what does that mean? It just means I'm really tired. And if they were old enough, they may say, well, why didn't you just say really tired? They don't sort of grab, kind of the figure of speech. You may say it's raining cats and dogs outside. And a child or an adolescent or adult with the autism spectrum disorder may say, no, it's not. It's just raining real hard outside. Well, that's kind of what I meant. So that's what we call literal rigid communication. Sometimes they struggle with understanding their communication is real literal, and it's real rigid and restrictive sometimes. Communication, that's another common kind of feature that we sometimes can see. Deficits, delays in social interaction, deficits, delays in communication. Here's the third one. It's a behavioral one. So the third one is just this. It's patterns of restrictive or rigid behavior patterns, which can include what's called fixated interests. So again, this is another one that can look a bunch of different ways. But at times, I mentioned obsessive OCD kind of a minute ago when talking about communication, real literal communication. Sometimes kids with autism spectrum disorder may have a little bit of obsessive compulsive feature to them as far as their behavior. Generally, kids with ASD like sameness. They don't like their routines disrupted. They may have some behavior patterns when it comes to getting dressed or play or eating food. Real rigid behaviors where it has to be a certain way over and over and over again, almost like obsessive compulsive disorder. It's not obsessive compulsive disorder. It basically is a feature of autism spectrum disorder, but it kind of looks like OCD a little bit. Real rigid patterns, real rigid, wanting sameness, getting agitated or stressed when routine is disrupted. They may have what's called fixated interest, where they get fixated on certain objects or certain things. It could be a TV show, it could be toys, it could be music. Get real fixated and real fixated interest on certain kinds of things. In severe cases with small children, they may engage in behaviors like hand flapping or finger snapping, or certain kinds of just other called behavioral tic, or a behavioral pattern that they may engage in over and over and over again. Again, we said in more severe cases of autism spectrum disorder, but use this rigid behavioral patterns again that kind of can kind of look like OCD. It's not OCD. Through the years, if some of you have been with me in the abnormal behavior class, and in the abnormal behavior class, we talk about obsessive compulsive disorder, the anxiety disorder called OCD. And almost every time we talk about OCD in the abnormal class, I usually will get a question either in class or in private about autism. and they'll say, you know, my son is, as we're talking about OCD, they'll say, my son is kind of like that. The example you said today about clothes in a closet or food or routine or clothes that he wears, he's real. He won't change what he wears. He's real particular like that. He's only like 9, you know. And sometimes I'll say, well, you know, sometimes with kids with autism spectrum disorder, they'll be like that. And sometimes students will say, well, yeah, they said he kind of had Asperger's. I'll say, yeah. So that's probably more what you're seeing. It's not OCD. It's more a function of autism spectrum disorder. So those are really general. There's a lot more I could say about just those 3 general types of symptoms: deficits in social interaction or socialization, deficits in communication, and then also to repetitive, rigid, restrictive behavior patterns and fixated interests. That's the third one. Oftentimes there's an overlap between all 3 of those. And again, the range of those symptoms can run from more mild to more severe. Key idea is that most of them are going to show themselves in a child's life before the age of 6, and how far they progress depends on the kid. Some kids, those symptoms progress very, very quickly and become very, very severe and then disruptive. Others are more mild. So there's this range of symptoms. And again, that's where the word spectrum comes from when it comes to autism spectrum disorder. Last thing I want to highlight for you just in this video very, very quickly is in the lecture notes, I give you some information about Asperger's disorder, or Asperger's syndrome. I do that because I usually have so many students asking me about Asperger's. I mentioned Asperger's just now a second ago. So technically, now don't get too hung up on this, technically Asperger's disorder is not a diagnosis anymore. As of the year 2013, there really technically is no such thing anymore as Asperger's. What we do now today from a clinical standpoint is kids who have the symptoms of what we used to refer to as Asperger's disorder. Today we refer to them as having autism spectrum disorder. Again, that we've sort of folded Asperger's into this larger umbrella term, autism spectrum disorder. But I do give you some information about Asperger's because, again, it's still somewhat relevant today. Lots of times students will ask me. Asperger's is often referred to as high functioning autism. And so this would be a case where, again, previously, what we used to refer to as Asperger's, generally Asperger's has 3 or 4 core ideas. Usually with Asperger's, what you see is advanced verbal communication, not deficits in verbal communication. You had kids who had all kinds of autism symptoms, but they had like advanced verbal. They were like 6 years old, talking like a 16-year-old, as far as like real intellectual, real high functioning, intelligent kind of kiddo who has advanced verbal abilities, but he or she has the behavioral, restricted repetitive behavioral issues, and then the issue of social interaction and socialization, not understanding social cues, deficits and delays in socialization, all the social deficits, the behavioral issues, but they had advanced verbal abilities. So that's what we used to refer to as Asperger's disorder, or Asperger's syndrome. I give you some information about that in your lecture notes, just so you're aware of it. I want you to be familiar with what is Asperger's, or what was Asperger's, so to speak. Just because, again, it's just been since 2013 since that disorder technically went away. And we still hear lots of conversations about it in the news today. And I want you just to be familiar with what it is. What is it? What are we referring to? What are your clients referring to? What are your friends referring to when they talk about a son or a daughter, or they themselves having Asperger's syndrome? Technically today, Asperger's, again, is considered a part of the autism spectrum. And so it really is considered a part, it is a form of autism spectrum disorder, this broad umbrella kind of term. So there you go. A little overview of our lecture notes. Go through, look at your lecture notes, check out everything I provided for you. Do your discussion questions, do your homework. Come back next week. We're going to do our very, very last developmental disability, attention deficit hyperactivity disorder, and I will see you then. Have a good week.